everyone. It's our
Hello.
Facebook Live sessions again. It's our weekly Facebook Live sessions again. So today we are very happy to have Dr. Teo with us. So Dr. Teo, say hello to everyone.
Hello everyone. I'm Dr. Teo. It's very happy to be here again, and I wish everybody Happy New Year.
Okay, so Happy New Year, everybody. So okay, today our topic is very uh, special in a way because you can see it from Dr. Teo's face. So why I say so? Because if you can see, Dr. Teo has a lot of hair. So today our topic is about hair. Okay, so I think 2 weeks ago we are talking. I spoken to Shaveen, the clinical psychologist, talking about social physic anxiety, right? So social physic anxiety. A lot of people will feel like not comfortable being judged how they look, and actually hair is one of the fear lah, especially for women. I think if we are balding, I think it's really quite a huge issue, and of course for men as well. And I think uh, thinning hair is quite common in men as well. And I don't know why recently there's a lot of people talking about this. Some say after vaccine they start to lose hair. Some say after COVID they start to lose hair. So seems like this losing hair thinning is quite a topic nowadays, and quite a problem that many people is facing. Okay, so Dr. Teo, can you actually explain to us actually what is actually hair loss, or in a scientific term, what is the name of hair loss?
Okay.
Alopecia, is it?
Yeah, it's actually hair loss in our medical term is called alopecia. And the
Okay.
most common of a hair loss nowadays you can see is androgenic causes. So we call it as an androgenic alopecia. This androgenic alopecia is actually not only happen in men, but also is certainly affecting the woman as well.
Mm.
So this androgenic alopecia is actually due to our androgen hormone, which actually I mentioned here is about DHT, dihydrotestosterone. So this one is actually likely will cause you to it affecting how much of hair you will be losing. Okay, it's actually
Okay.
most commonly. But other than the androgenic alopecia, we also have sometimes something called like a scarring, which actually is due to some infection or is most probably due to some disease, or you are using like a chemotherapy, or which actually mentioned earlier, my mishap is actually due to some autoimmune, which actually triggering your immune to attack your hair follicle. It could be possible after the vaccine, but there are actually not much of a study on this, but there are just some myth, going on. Yeah.
Okay. Okay, I see. And also, it's quite common for women postnatal to also drop hair, right? The hair
Yes.
start.
Yeah,
Yeah.
actually postpartum is actually after, because we actually hair we got a lot of phases. Okay, so if it's the woman is actually the telogen, the hair is actually after telogen phase already, so the telogen will actually drop mostly. But don't worry, it's actually it will regrow back. Most of the people they will actually regrow after like maybe six
Okay.
months time. Yeah, but it will just take some time for them.
But it's
So
quite scary, you know. I mean,
yeah.
when I have my two kids, my second kids, I think my balding was like, wow, higher up, and the hair was like, you can see patches of hair drop. And when you wash your hair, it's like,
Yeah,
like
you will
you're
see
dropping
like,
hair,
yeah,
you're sick like that.
it's like suddenly it's like, oh my god, why suddenly the hair everything is dropping? But it's actually it's due to the some hormonal changes as well. Yeah, it's all due
So
to
when a woman, I think basically when they are pregnant, the hair is very nice, right? Because of the hormone. And when
yes.
after they give birth, then when the hair start to drop, it's really scary. So is it more common to have hair thinning in men or in women?
It's actually I would say is more towards genetic dependent. Yeah, it's
Okay.
actually genetic dependent. If it depends on the family. So if their family have a very strong gene, then you are actually having a faster
So
hair.
if your parents are bald, you are high chances will also be bald.
Yeah. You can say that. Yeah, you can say that. So it actually doesn't mean that the male actually will cause more more hair loss chance, but the woman won't have that kind of issue. No, it's actually is equal. So it's just that depends whether inside your family the thread, how is the gene thread. When we talk
Okay.
about the gene thread here, is actually how sensitive. It's not like, oh, you are having a more hormone, DHT hormone in your family history. No, it's not that one. It's actually what I'm talking about here is the sensitivity, because your hair follicle have the receptor, the androgenic receptor. So if your genetic is set to be like, oh, more specific, like more sensitive to this DHT, then it will actually absorb more DHT and it will drop. Yeah.
Okay.
Yeah.
So if I don't want my kids to be bald, so can I say that when I find a husband, I should find somebody who is full of hair?
No, actually, I have some face some situation is previously they told me that actually my family don't have, it's just me, sometimes it's just me.
Oh,
So yeah, this kind of situation will actually I met before. So after I study a while, in fact, is actually he is carrying the gene, but it's just that maybe sometimes they are not activated, because
oh,
this one is not purely about the genetic. It also affected by your external factor, which actually like how is
that's
your
right.
lifestyle, yeah, how you treat your hair, do you actually treat it well, or do you
Yeah.
actually tie your hair and things like that.
Okay.
So actually, yeah, we're affected
So number
also.
one is genetic. Like if you have good genetic, good lifestyle, then most probably you will be able to have more hair. Lah. If you have good genetic, bad lifestyle, so you might also lose your hair. If you
Yeah,
have bad genetic and bad lifestyle, then chances are you are very high to get
yeah,
bald.
yeah.
Also, if your genetic is not good, make sure your lifestyle is good to compensate in a way. But Dr. Teo, what is the age that you will start to see hair loss? Usually
in
it started in the mid age or old age, right?
In fact, that one old school thought is actually like, oh, if you are like 40 years old or 50 years old, you will only start, some hair drop or hair thinning kind of thing. But in fact, after the studies, it showed that actually hair thinning can start as early as 20. So,
Oh,
as 20 years old time, you start to actually have a hair thinning. In fact, our hair drop is actually daily is about 50 to 100 strand. So
okay.
if it's a 50 to 100 strand within that, then you are actually still, yeah, in the safe, quite
Okay.
safe. So
Okay.
it's actually a physiology. Our hair will drop, our hair will drop. But if more than that, like for example, 200 strands per day, then you can actually see thinning progress is ongoing. Yeah,
So
hair
it
drop.
means that your hair is dropping faster than it grow lah, right? That's why you start to see it's thinning.
Yeah. Yes, exactly.
Okay. So,
Well
but
said.
usually I will see people, especially men, usually
Mm.
after 40, they start to lose their hair. Why? What is the reason?
In fact, it's due to aging. I would say it's
Aging.
the aging. Yeah, because we cannot stop the aging process. In fact, if the aging is ongoing, that means your receptor, your blood circulation and everything is actually dropping, and even your hormone, your DHT hormone. So, if actually it's a multifactorial causes, but the main issue in the old people is actually due to aging,
Due to
where
age. Okay.
yeah, the
So,
absorption is.
of course, again, if you are having hair loss at an earlier age, you better start consulting doctors to see what is the factor that actually triggers your hair loss. Maybe your
Yeah,
hair is too oily, too much dandruff, you have too much stress, your lifestyle is not good, your hormonal is not balanced, your genetic problem. So there's so many factors that actually cause hair loss. Okay. So if you experience hair loss at an earlier age, it's always advisable to go for a consultation because you wouldn't want to be bald at the age of 30 or 30 plus, right? So of course, bald can be also a trend. If you like to be bald, it can be also a trend. It's not that we discriminate. It's just that if you have a choice, would you want to be having more hair? Okay, so okay, so just now we said the main factor of hair loss can be genetic factor, but we can see that more and more people are losing their hair at an earlier age, right? So can it be also because of stress?
Yeah, when they actually stress can indirectly causing is because some people they're actually triggering the hormone. You know, when we are talking about the hormone, yeah. So some people they might think that actually is it due to the a lot of testosterone, because this DHT is actually coming from a byproduct from the testosterone. So people were actually thinking, if my testosterone high, will it be equally due like my DHT as well is high? So both is actually is the dependent on the converter, which actually is an enzyme. It's a 5-alpha reductase. So this enzyme will actually determine how much of a DHT of your body, your conversion. Okay, so this one is actually if you are in a stress condition. Okay, when you're in a stress condition, everything will go haywire. Your hormonal will become imbalanced and everything. So yeah, it actually definitely will cause you have some of the hair loss as well.
So
So the
seems like stress is number one killer for sexual, for hair loss, for everything. Okay, for better health, make sure your stress level is in under control. Okay,
yeah,
and of course, again, if you have disease, especially if you're going through therapy like chemotherapy and etc., is definitely you'll get a hair loss lah. So and also long-term medication consumption, right? So what are the usual medication that we eat that might cause hair loss?
actually is if more towards I would say something to do with a chemotherapy, because
Okay.
it's like immune like because you're in like for those who actually having the cancerous cancerous tumor kind, when they are against undergo the therapy chemotherapy.
Dr. Teo, you're getting softer and softer already.
Oh, sorry, can you hear me now?
Oh,
Can you hear me?
okay.
Yeah, it's better now.
But not very loud. Just now was louder. I don't know why you're getting softer. It's okay. We can
Maybe
continue.
the line.
Okay.
the
Okay.
line. So yeah, so actually this one is due to mostly all the people with the chemo, due to the cancerous, I would say the cancerous, and sometimes of course some like drugs, the kind of things. So this kind
Mm.
of thing is actually we are trying to avoid. Other than that, all other medication I still think is okay.
So if some people like they take a painkiller very often, will that also cause them to have hair drop?
Usually
Not
won't.
really lah.
Painkiller actually is will cause the kidney failure. Usually
Okay.
because the painkiller when they will filter in our kidney or in
Okay.
some in the liver, which actually cause some hepatitis. So
Okay.
otherwise, hair
Not
won't
so much lah.
yeah, not so
Okay,
much.
so hair is more related to chemotherapy or chemo medication that cause hair loss lah.
Yeah, autoimmune. Yeah.
Will malnutrition also cause hair loss?
Actually, your hair need a lot of supplement inside. Okay, so if you malnutrition, you will start to see your hair shaft to become thinner. Your hair shaft will become thin, and then you will start to see your hair actually drop a little bit more, slightly more, because they tends to get less of a vitamin. Actually, specifically like vitamin B6, B12, and also biotin. Actually, this all is to support the hair strength so that actually it's actually can stand on your scalp there.
Okay. Okay,
Mm.
so of course there are also a lot of myth about hair loss, right?
Oh,
So is there any myth example that you can tell us? I know that we always know that, oh, don't eat Maggie mee, then you will drop a lot of hair. That is one of it. Is it true or is it a myth?
actually, it's actually not a truth, because some this can related to be like MSG. Some people think that
Okay.
actually if I eat a lot of MSG, will I actually get a hair loss? Because my mom used to tell me, you eat more, you eat more, you eat more, then later you don't have hair when you grow up.
Yeah, like
Like
if
that.
you eat salty, MSG, too much of preservative, people will think that you will lose your hair. But it's actually true or not true?
No, actually, after a lot of studies being done, that actually is not a truth. Okay, but it doesn't mean that you can eat more MSG. Okay, because
Okay.
actually it's not that not to say that actually for the hair loss,
Not
but it's
correlated lah. It's not
not
correlated lah.
yes, but
Of
it's
course,
also
eating Maggie mee is not healthy, but it's not really the correlated to hair loss lah.
yeah, it's not directly causing. It's not MSG won't cause actually. Yeah, and then some even I heard about is like if you like for those who actually like to wear caps, you know, when they
Uh,
want to wear caps, you know, so like they will say that you wear the cap inside the house, later your hair will fall more. Actually, you know, some people they will think like that, or they like to wear the kind of like a cloth, they like to tie and everything like that. So actually, they say they would say that actually if you putting up a cap, your hair cannot breathe. You know, because when the
okay,
hair cannot breathe, you don't have the O2 there, oxygen not enough, then you start to fall. You know, then your hair will die. But actually, that also is a myth. It's not the truth, because
okay,
your hair follicle can get oxygen supply from the blood circulation in the scalp,
okay.
so it won't die because of oxygen.
So
So
if
like,
you tie your hair too tight,
oh, that one, yes.
okay,
Because when you are tying your hair, for those who actually like, when they like to tie the hair, and also they like to change their hairstyle, because sometimes people like to change here this side, sometimes people change this side. This kind of thing is actually you are causing stress at the hair root area. So this one will actually causing your hair to drop. Physically stress. I would say physically stress. Yeah. So when you're
okay.
yeah, your
So
cost.
what do you mean? You mean you cannot flip your hair all the time, is it?
No, flipping is okay, but you like I would say it's like a hairstyle, because guy they like to, this time here, that time here.
But the
Okay.
problem is when here got hair, they put here, ma. Then here don't have hair, then they cover here, right?
So actually, you are changing the hair root, because sometimes if you are sometimes slightly is okay, no problem. But if you
Okay,
are like, you have to like force it, and then after that you have to put a gel and everything, to
okay,
spray until very hard. But that one is actually the hair root itself will actually cause some
okay. So applying too much chemical into the hair also will cause hair drop, right? Like if I color my hair too much, I perm my hair too much, use so much of spray and things like that.
Some people would say that actually this one is due to the scalp. If you have a healthy scalp, you will have a healthy hair. This one is actually quite true, because if
Okay,
you are applying all the chemical, which actually will tends to have a clot at the hair follicle area. So when it clots, the new hair cannot come out. A healthy hair follicle will have at least 4 to 5 hair, when they
okay.
grow. So when you are tends to use a lot of chemical, which actually will trigger more oily scalp. When the oily scalp actually will cause a clot at the hair follicle, so the new hair cannot really grow out very healthily. Lor. This is actually the theory behind. Yeah.
So, some people wash their hair once a day, some people wash their hair twice a day, some people wash their hair once, no, lah, okay, lah, maybe 2 or 3 times a week. Okay, means like once in 2, 3 days. Lah. So, does washing hair has anything to do with hair thinning? Well, I
Okay.
wash my hair too much and my hair become thin.
In fact, it's actually the process of washing hair, because if you are washing your hair, you tends to actually massage, or sometimes your fingernail is very long and you will actually
Mm,
scratch it, it will harm the scalp. But otherwise, if you are talking about the washing your hair with a shampoo purely, it's actually won't cause a drastically hair drop, because a healthy scalp is actually a clean scalp is actually equal to a healthy hair. You have a healthy hair growth. So if like for example, one day if you're washing the hair twice, it's okay. If your scalp is the kind of oily kind, but of course if you are like, some people will ask, if I the more I wash, because my scalp is actually dry already, it detected dryness, so will it actually trigger more oily? Yeah, in
mm,
fact it will. So you have to adjust accordingly. Sometimes it's very dependent. If you are having a oily in the morning, after you wake up, then yeah, you can go ahead. But not I mean, the way that you wash it, you have to be very careful not to scratch on your scalp. That one will actually cause a damage, and it will actually very very bad to the hair growth. Yeah.
Yeah, I think especially a lot of people who likes to go to hair salon, and if they scratch the hair for too long and too much, it will also hurt the scalp lah. So whatever we do, just make sure we have healthy scalp and clean scalp, right? If you are very active, you do exercise a lot, then you might produce a lot of sweat and dirt. Then you might need to wash your hair twice a day. But
Mm.
if your hair is very clean, maybe you can wash it every 2 or 3 days. As long as it's healthy, it's clean, then it should be okay, right? So the frequency of the hair wash will not cause you to lose more hair, but how you wash your hair will might affect it if you're too scratching too much on your scalp and all this. So of course, again, we have seen that a lot of Indian people, they have very nice hair, right? So they always say they put coconut oil, right? Because they are like black, very got volume and nice hair. So is it true that coconut oil will actually helps you to strengthen your hair?
This one actually I have done. I do some research and study on this. The result is actually is like a 50-50, because it's actually incomplete. Some people they might say that actually applying the coconut oil will actually trigger more hair growth, but some it actually the study show that won't cause the hair growth, you know. But in fact it will actually cause more harm, you know, due to the oiliness or due to the improper kind of the way that actually you apply, you know, because you just buy it and then you just like, okay, I apply like this, is it like this, or you know, twice a day or 3 times, you know, or some
Got
people
too
that
oily and clog the pores.
it will actually cause like a adverse effect, you know, you make the
Okay.
situation worsen, you know, worsen the situation. But
Okay.
in fact, if like maybe a little bit of coconut oil, we actually will trigger, you know, sometimes a little bit. So yeah, and I did see that actually some of my Indian client did actually, you know, they told me that no, actually coconut oil doesn't help them at all, you know, because they said that I apply a lot, but still I get the hair dropping, you know.
Yeah, yeah.
Of
So
course, that,
again, I think there is so many factors to why you lose hair. So depending on what is the reason you're losing your hair, you need to solve the problem accordingly. So let's say it was your hormone that is causing you to lose hair. Then maybe doing a blood test and checking your hormone, taking supplement will be better to correct it. And if it's the shampoo that you use not correct, you're hurting your scalp too much, then maybe correcting your shampoo will be the right things to do lah. Also, finding the reason why are you losing hair is actually very, very important. So,
mm,
but there are also a lot of people advertise that taking supplements can actually helps you to grow hair or actually prevents hair loss. Is it true? Is it possible?
okay, for example, if you are talking about the hair supplement, but like for example, biotin. Okay, so there are a lot of people that taking about the biotin. It actually works. Everybody actually works based on the individual. Some people
Okay.
they actually after taking they feel the hair grow, but some people after they're taking the biotin, they actually won't feel much improvement, but instead they feel that actually their nail growing, you know, other part of their hair actually around their body is
The
growing.
body hair is more.
Yeah, but not the hair, you know, not the hair, the scalp part, you know. So yeah, it's actually very dependent, and again, it's due to what kind of the cause actually for your hair loss. It's actually mainly for those who are not like androgenic alopecia related. Then of course, yeah, you can have a you know, supplement, but of course lah, if you are actually like taking the supplement, the effect whether or not will up to your expectation, that is actually a question mark. Yeah.
Okay. Okay. So when you start losing hair, will it be permanent? Like some people, once they lost the hair, it's like they cannot grow back.
Okay. So once you start realize you have a hair dropping or hair loss or hair thinning, it's actually it was that means your journey start already. That means that time onwards it will actually keep on going and ongoing. It's just based on the severity, which actually can be determined by your external factor. So once you're having the hair loss, as long as your hair follicle is there, then we can actually do something. Okay, but if of course if your hair follicle, the kind of people who are actually having a shining kind of a scalp area, that one is actually I would prefer them to go for hair transplant.
Okay. So
Yeah, but
if there's no more hair follicles, then all these non-invasive treatments doesn't really work anymore, lah, right? So you need to go for hair transplant,
yeah, most
like a
likely.
surgery kind of hair transplant, right?
Most likely.
Okay. So if we still have hair follicles, means like just starting to have hair thinning, what are the options, treatment available that we can consider?
Okay, of course, if you come to a treatment, we actually, first of all, we have to understand what is the cause first. So
Okay.
actually the cause is mainly, as I mentioned already, most likely is actually androgenic alopecia, which actually is due to the hormonal. Of course, starting itself, we will actually start with our treatment, which is actually like topical, and then we can have an oral supplement, and the third one is the injection. So the first one is actually topical, is like a hair serum, but with the hair serum itself, because this actually the androgenic alopecia, this one is actually we will actually prescribe some finasteride or like minoxidil, this kind of a hormonal medication to stop the DHT sensitivity of the receptor among the hair root itself, so that actually is less sensitive, so that your hair won't drop that fast. Okay, meanwhile we actually eating the oral supplement, which actually can be easily absorbed by the hair follicle, is because minoxidil will dilate the blood vessel. Okay, and then lastly the injection part, because sometimes your blood circulation is not that good enough, so that we directly inject the
To the
supplement,
hair.
yeah, to the hair, the biotin, the vitamins and everything, which actually turn out very, very good result. Yeah.
Okay. So usually we will do like the vitamin cocktail, or we will do PRP, or even exosome kind of growth factor, right?
Yeah.
So usually how many sessions do we need to do in order to see good results?
One course is about 6 times.
This
So
time.
6 times, yeah, 6 times. So like for example, if you start the treatment for the injection, mainly is I'm talking about the injection. So like for example, today you have the injection. After 2 weeks, we will repeat. And then until the fourth session. So after completed the fourth session, we will actually about 1 month, then you come and one time. But it's actually, this one is just a very general. It can be very to individual. So consultation is very, very important. You have to come first, then we have to discuss and work out together for the plan. Because I have to know your lifestyle, I have to know what is the cost, sometimes. Yeah. So after everything already very clear, then only we can plan properly.
So Dr. Teo is actually our hair expert in B&Co Clinic. So since he come beneficial a lot of our staff, I think one of our colleague Eldon did one sessions of the hair, and he was like already have hair thinning because he is at like 50 over years old. So we also have the testimonial. If you were to come for consultation, Dr. Teo can always show you the testimonial of Eldon, because it was only one session. He actually see tremendous improvement. So I think, of course, like Dr. Teo said, usually you need 4 to 6 sessions to do a complete course. So if you're interested with hair growth, you want to prevent hair thinning, you love, a lot of hair like Dr. Teo, please come and make appointment with Dr. Teo to do a free consultation. So if you're interested, you can always message us on the Facebook Live, or you can even DM us on this to inquire about our hair treatments that was customized by Dr. Teo. Okay, so Dr. Teo, so what are the differences of treatments that is available, and how effective, and is it costly, or how?
It's actually, if you ask me, frankly speaking, I would think that it's a combination is the best. Always the combination is the best. Why? Because it's actually a time consuming, you know, because a hair you want to grow actually is a very, very time consuming. Sometimes it might take up to 1 year because up to the length that actually is our expectation. Okay. Is
True.
also, yeah, so that actually I don't want to, you know, after one you know, one we start with like, okay, oral supplement first, after 1 year cannot already, then after that, you know, we start on another one more, so that is actually very time consuming, and we lost to the aging process, you know, because what
Okay.
we want to do is we want to fasten up the hair growth, meanwhile we have to protect the existing hair and also stopping the hair from dropping, so the
Yeah, I think
combination.
what Dr. Teo said is true, because if you want to grow so much of hair, it might take you a year, right? So when you start to have baby hair, you want to protect the baby hair to make sure that baby hair can grow longer, right? So I think 1 year is a good expectation, and you should take good care of your hair regardless, you know, you are losing hair or not losing hair. I think it's also a lifestyle, it's also a habit. You know, some people just don't care, they use very harsh soap on their hair, and the hair becomes so dry, the scalp becomes so dry, or some people don't even bother to clean the hair properly. The hair follicles become so oily and so clogged. That's why they start losing hair. Okay, so if you're interested on how to take good care of your hair and want to have more hair and to prevent hair thinning, remember to contact Dr. Teo. Okay, so thank you everybody to attend our this Facebook Live. If you need more information, always contact us or DM us. Okay, so thank you very much, Dr. Teo. Happy New
Okay,
Year, everyone.
happy new year.
Bye.
Bye.